Hello, my name is Krista. This educational video is a collaborative effort between Providence Sacred Heart Medical Center and Children's Hospital, the Level 1 Special Pathogens Treatment Center for Region 10, and Spokane AMR, our dedicated EMS transport partner in Spokane, Washington. Together, our teams have developed the protocols in this video through a shared internal process based on nationally recognized best practices and informed by subject matter experts. We've partnered to produce this training video to help our teams coordinate seamlessly and provide excellent care to patients. In this video, we'll guide you through how to set up a doffing station in any environment for EMS providers, followed by ambulance decontamination, the safe removal of appropriate PPE with the assistance of a trained observer, and finally, proper cleaning and decontamination of the doffing space. This is intended for EMS personnel transporting patients with suspected or confirmed high-consequence infectious diseases, or HCIDs. These pathogens include viral hemorrhagic fevers, such as Ebola virus disease, Marburg virus disease, and Crimean Congo hemorrhagic fever, among others. Throughout this video, you'll learn the core elements of a properly designed doffing station that can be adapted to any facility environment, how to safely doff appropriate PPE using a trained observer and checklist, how to appropriately disassemble the doffing area while maintaining safety and adhering to proper infection control practices. To begin, we'll set up the designated doffing area, which in this scenario is located in a hospital facility's driveway. This setup should be completed before EMS personnel exit the back of the ambulance following patient transport. Depending on the transfer location, the doffing station may be established by either the receiving facility or the EMS agency. In today's demonstration, the patient has already been successfully transported via ambulance and transferred into the care of the Special Pathogens team at Providence Sacred Heart. Assisting with the setup of the doffing station today are Julie and Cassie, who will make sure the area is ready before our caregivers begin the doffing process. The supplies and kits shown in this video were thoughtfully developed to support the internal workflows of both Providence Sacred Heart and Spokane AMR. For a detailed supply list, please reach out to the Sacred Heart Special Pathogens team using the link provided at the end of this video. Now we're going to set up the doffing station. Begin by inspecting the setup area to make sure it is free of hazards and debris before initiating the setup. Now define clean and dirty zones. Identify and mark the clean and dirty zones before placing any doffing pads. The clean zone should be positioned farther away from the ambulance doors, allowing for EMS personnel to exit into the dirty zone and place the stretcher to the side, still on the doffing pads. Now lay down doffing pads. Once those zones are identified, lay out 3 doffing pads. Secure all edges using duct tape to prevent movement or tripping hazards. Now label zones with vinyl tape. Use green tape to create a solid line outlining the clean zone. Use red tape to create a solid line adjacent to the clean zone, and mark the dirty zone with cross pieces of red tape. Now position the trash cans. Place double-lined biohazard bag trash cans near both zones, making sure they are not on top of the doffing pads. You'll need 2 trash cans on the dirty side and 1 on the clean side to the right of the red doffing cart. Now set up the portable shower stool. Place the stool between the clean and dirty zones, making sure its legs are fully extended and stable. Prepare the dirty zone table. Place the first portable table in the dirty zone and label it appropriately. Place hand sanitizer, disinfectant wipes, and 1 box of each size of nitrile gloves on top of the table. Now we're going to set up the doffing cart in the clean zone. Position the cart just off the doffing pad in the clean zone. The cart should include a large red bin lined with a clear plastic trash bag, a small plastic bin also lined with a clear plastic trash bag, and hand sanitizer and disinfectant wipes. The doffing station is now fully set up and ready for EMS personnel to begin the decontamination and doffing process. With the doffing station now fully set up and ready to receive EMS personnel, we begin the decontamination process by carefully backing the ambulance up to the dirty side of the doffing pad. It's critical to have enough space for EMS providers to safely remove the stretcher and proceed with the following steps: processing out Category A waste, decontaminating and doffing the draped ambulance, and doffing the EMS provider from their high-level PPE ensemble. In this scenario, the ambulance driver will serve as the trained observer, equipped with appropriate personal protective equipment, or PPE. This includes gloves, gown, face shield, a fit-tested N95 respirator, boot covers, and a surgical hood, collectively referred to as PPE in a bag. This type of PPE is commonly used in emergency or frontline healthcare settings when managing a patient suspected of having a high-consequence infectious disease. Now position the ambulance by backing it up to the dirty side of the doffing pad, aligning it so there's no gap between the vehicle and the pad. This ensures that EMS providers can step directly onto the doffing pad from the rear of the ambulance. Now the driver is going to don PPE. They will exit the vehicle first and don their PPE in a bag with assistance from a support person who follows the PPE in a bag donning job aid. The EMS providers inside the ambulance will open the rear doors from within. They will both exit by stepping down onto the doffing pad and carefully remove the stretcher, placing it to the side within the dirty zone of the pad. They will then decontaminate the stretcher. They will wipe it down thoroughly with EPA-registered disinfectant wipes. Ensure the disinfectant remains on the surface for the full contact time specified by the manufacturer. Now we're going to process Category A waste. Remove any loose trash from the ambulance and dispose of it in the designated trash cans. Ensure that each container is filled no more than 2/3 full to prevent overfilling and facilitate safe handling. If waste needs to be processed out, double bag the waste using red biohazard bags, wipe down the outer bag or any contaminated bag originating from inside the ambulance, following Category A waste management procedures. Next, the EMS providers will remove the interior drapes from the ambulance in a slow, methodical manner, working from right to left. Fold the drapes away from the body, touching only the exterior surface. Then you're going to place the removed ambulance drapes into the designated trash cans. After the waste has been properly discarded, the EMS providers will return the cleaned stretcher to the interior of the ambulance. Once the stretcher is secured inside the ambulance, the EMS providers will communicate with the trained observer to confirm they are ready to start the doffing process. The trained observer will then guide one EMS provider through the doffing process, starting on the dirty side of the doffing pad. The second EMS provider will remain inside the ambulance until the first provider has been fully doffed and the doffing area has been cleaned and reset for the next provider. Now we'll transition to the doffing process. The PPE ensemble shown in this video is one of several appropriate options for caring for patients with HCIDs. Both Providence Sacred Heart and Spokane AMR use what we refer to as high-level PPE when caring for patients with high-consequence infectious diseases. This ensemble supports consistency, collaboration, and the highest standards of caregiver safety across both teams. Now we're going to prepare to doff PPE. Prior to starting the doffing process, make sure management of all Category A waste and decontamination of the ambulance is completed. The trained observer will confirm readiness to begin the doffing process with the caregiver inside the ambulance. The doffing assistant will act as the trained observer during this process. If physical assistance is needed to doff due to fatigue or a medical condition, additional staff will need to act as the trained observer. The caregiver will proceed out of the ambulance onto the dirty side of the doffing pad. They will perform hand hygiene. The trained observer will read safety instructions by asking the caregiver, "How are you doing?" Reminding them this process will be slow and methodical. They will walk you through every step and not to proceed without instruction and to keep your hands away from your face. Next, the trained observer will inspect for soiling. They will watch as the caregiver turns slowly to check for any visible soiling. If soiling is present, they will talk them through the breach process. Now you're going to doff the apron. Remove the apron starting at the waist and doff, taking your patient care gloves together with it. Then perform hand hygiene. Now you're going to doff your tape. After doffing your tape, you will doff your external gloves using glove-in-glove technique. After doffing your gloves, perform hand hygiene. Next, you will untie your PAP or hood at the waist only and gently discard the tie. Perform hand hygiene. Next step is going to be doffing the coverall. You'll start by reaching under the hood and find your belly button with both hands. You will then untape by exposing the zipper, moving your hand down to the bottom of the zipper, and then moving your hand slowly up to the neck, finding the Velcro, undoing the Velcro, then finding the top of the zipper and unzipping the coverall. Next, you're going to remove your coverall off your shoulders and down to your waist. You will remove your arms from the sleeves, turning the sleeves inside out. You will proceed with doffing the coverall by pushing it down, touching the inside only. You can use the stool as needed to complete doffing the coverall. You will doff your outer boot covers with the coverall. Roll the coverall and the outer boot covers into a small ball, touching only the inside, and then gently discard. Now you will perform hand hygiene. Next, you will untie the necktie, gently pull out the tie, and discard it. Then perform hand hygiene. Now you're going to doff these gloves using glove-in-glove technique and gently discard them in the garbage can. Once your gloves are discarded, perform hand hygiene and don clean nitrile gloves. The next step in the doffing process will be to remove the hood from the PAPR helmet. Leaving your helmet on your head, remove the hood from the back to the front in the following manner. Use both hands, reach under the hood to the back of the helmet, and fold the hood over the filter, completely covering the filter. Then remove the hood from the back to the middle of the helmet at your ears. Unsnap the visor from the two side tabs. Then fold the visor together and unsnap the center tab, and then discard the hood, touching only the inside. Then perform hand hygiene. Now you're going to proceed to the stool to doff your inner boot covers. Sitting on the stool in the dirty square, remove the first boot cover, touching the inside of the boot cover on the foot, extending the cover over the heel, remove and gently discard. Place your foot into the clean square without setting your foot down in the dirty square. Now you will doff the second boot cover in the same manner and place your foot down into the clean square. Go ahead and stand up in the clean square and perform hand hygiene. Next is doffing the PAPR and the battery. You will stand facing the cart and loosen the knob on the PAPR. Bend forward and remove the PAPR from the left side and place it in the red bin. Then unplug the cord from the battery, contain the cord, coil it up, and place it inside the middle of the PAPR. Remove your bouffant cap if you're wearing one and gently discard. Then remove the belt with the battery and place in the same red bin. Perform hand hygiene. Then doff gloves using glove and glove technique and gently discard. Then perform hand hygiene before leaving the clean zone. You will then proceed to the special pathogens unit to wash your hands with soap and water up to the elbows. You may also take a comfort shower if needed in the special pathogens unit, following the shower protocol as written on the signs posted in the bathroom. Next, the trained observer will clean the doffing area. They will begin by removing the PAPR, belt, and battery from the bin and disinfect them each with disinfectant wipes. They will then place them in the plastic-lined bin located on the table. Next, they will disinfect the stool, table, hand sanitizer dispenser, and any other surfaces that could have been touched during the doffing process. Process waste is necessary. And after the PAPR and the battery have had enough contact time, tie off the plastic bag and process out of the bin. Once the first EMS provider has completed the doffing process and the area has been cleaned, the trained observer will initiate communication with the second EMS provider. At this point, the observer will guide the second provider through the doffing process, ensuring all protocols are followed with the same level of care and precision. Now that both EMS providers have been fully doffed from their high-level PPE ensembles, the EMS support person and trained observer will begin the cleaning and disinfection of the doffing station. Both individuals will be wearing PPE in a bag. Once the area is cleaned and disinfected, the support person and trained observer will complete the decontamination process. Carefully remove the doffing pads by touching only the exterior surface. Avoid stepping on the pad during removal. Fold the pad inward and discard appropriately. You will then process any remaining Category A waste according to established protocols. Next, you will doff your PPE in a bag following the PPE in a bag doffing job aid to safely remove PPE. Perform hand hygiene and don a new pair of gloves to complete the final waste handling. You will process the final trash bag and place it into the designated receptacle. Doff gloves carefully to avoid contamination. Perform hand hygiene, and the cleanup process is now complete. Once the doffing station cleanup process is complete, the ambulance must undergo a thorough disinfection by designated personnel in appropriate PPE, trained in the proper use of approved disinfectants and equipment. This may include an initial wipe down of all surfaces, followed by advanced disinfection methods such as hydrogen peroxide vapor, ultraviolet light, or other technologies as outlined by your agency. Please note, this advanced disinfection process is not demonstrated in today's video. Always follow your organization's policies and protocols to ensure the ambulance is fully cleaned and disinfected before returning to service. Proper adherence to these steps is critical for patient and provider safety. Thank you for watching this video on the safe decontamination and doffing procedures for EMS providers and ambulance following a suspected HCID transport. Consistent practice, clear communication, and adherence to these guidelines are essential in reducing risk and preventing contamination. Your commitment to these standards makes a critical difference. Stay safe, stay prepared, and thank you for your unwavering commitment to infection prevention and control protocols. For more information or requests for resources, please reach out to the Providence Special Pathogens Program.